done quickly.
I appreciate it.
Hi there. Thank you so much for your time. And as Georgie mentioned, thank you so much for providing answers ahead of time, because it definitely helps us start planning ahead already.
Good.
But there's two, I think, from my end, and then I want to let the team ask any other additional questions. But after reviewing your answers, there are really two things that I would like to have you elaborate a little bit.
Sure.
So in that first question, when we asked about pre-existing conditions, right, that you mentioned that there's like, we have hypertension, high cholesterol, tobacco use, but then you also added tobacco use, and I'm saying, so that's lifestyle choices, right? So could you elaborate a little bit more on the lifestyle choices that that could affect patients, right, that have also pre-existing conditions?
Absolutely. So, and I don't have that list in front of me that I emailed, but it would also include diabetes. Although I think that was part of the question.
Yes.
So those are sort of the basic, what we would call risk factors, or the traditional risk factors for cardiovascular disease. Many of them are influenced by lifestyle choices, and perhaps even a better word than choices is sort of behaviors, because sometimes behaviors are influenced by a lot of things external and not only by choice, but certainly sedentary lifestyle, insufficient exercise, dietary habits or behaviors, and in some cases choices that and even sometimes cultural issues that lead to high salt, high sugar, and a diet sort of high in very processed foods. These are all things that contribute both to high blood pressure, to diabetes, to obesity, which then further contributes to both of those. And then sometimes sedentary lifestyle in and of itself, even in someone who may be metabolically still very, very healthy, is felt to be a detriment. So those are the types of things that we focus on and stress when we see patients. So exercise, eating well, avoiding sugars, carbs, processed foods, trying to get a wide variety of fruits and vegetables, and those types of things.
Absolutely. And I think that takes us to, I think it was your last answer that you mentioned that there's such a high level of distrust in the health system, right? And I know resources, having resources, right? And also having education, but it happens at such a systemic way. So can you elaborate about, you mentioned trusted partners is important. What type of trusted partners are we talking about here specifically?
So when I said that, I was thinking more of institutions like churches. That's a very big part, very often, of the Black community, and they can be a source of information and activism, or just quite frankly health screening, where people can get information, be sort of reminded or told of the importance of seeking help, and knowing their numbers from people that they trust, who then will engender trust. And then there are some more sort of novel approaches that have been studied and looked at. I think even FIU has an outreach program through barbershops. There's barbershops in the Black community, and perhaps it's every community, sort of your hairstylist, but certainly the barbershop, it's sort of a safe space where people go and talk, and a lot happens. And I think it has been written about and published that can be a location where people can get health information and develop some health literacy, and to some extent, perhaps even some health screenings. And actually, one of my medical students just yesterday or 2 days ago was saying there is some sort of barbershop initiative at FIU that is trying to reach the community through this particular venue. So those were the two things that I had in mind when I talked about trusted partners. But it could be any number of other things where people go anyway, have relationships, and then they could tack onto those existing relationships information and opportunities and screenings sometimes.
No, yeah, definitely. That is very helpful. And I'm going to look into the FIU case. Since we do national, I think it's a very interesting example of what can be done across the nation, right? And if it's being done right in our backyard in Miami, it's definitely something that we can talk about. That's great. Is there anything else? And I mean, I'm mindful of your time, and I know that John here too. Is there anything else that you think we must be including? As you know, it's American Heart Month now in February. And this community is like over-indexing in health and heart health.
I just think this time that we're in the pandemic has sort of shed further light on disparities, not just in minority communities, although yes, in minority communities and underprivileged communities. And I think it just reminds us, I think when we see patients as physicians, to try to be as non-judgmental as possible. So some of it is choices, but much of it is circumstance, and people without resources to have easy access to healthcare, but even more fundamental, without easy access to fresh food and under-processed foods, and trying to look not just at individual solutions, but system-wide solutions, and reducing sugars in foods and sodium and processing. So I think there's much more than just the individual to solve this problem. It's going to have to be at a public health and policy level. I think that's one of the messages I would like to drive home, because I think it really is very much true, and I think the pandemic, further underscores that. And I think we should also take the opportunity to remind the Black community to get vaccinated. And there's a lot of distrust in that in and of itself. And patients with increased cardiovascular risk are at higher risk for severe cases of COVID. So it can be even more of a self-fulfilling cycle. So we should stress that as well.
Absolutely. Well, thank you so much. This is incredibly helpful for us. John, do you have any questions that you want to ask?
I think, Doctor, you covered it in your last statement there regarding COVID-19, and I know that the African-American community has been I believe, disproportionately more affected than the rest of the population because of this possible distrust or not getting the proper health care or whatever for socioeconomic reasons. I guess anything else you want to say in that regard? I think you said it, but in terms of especially COVID and its effects on the heart muscle particularly, and is there anything else you want to say regarding COVID and the African American community?
So I think we summarized it. So I think because the African American community has disproportionately more of the risk factors that are known to be associated with worse outcomes in COVID, that may be part of why we're seeing these higher numbers in this community. And it may also still relate to sort of health-seeking behavior and distrust of the health system, and or just access issues. So having insurance or transport to easily get to a testing site, and these types of things.
Okay. Thank you very much. Appreciate it.
Of course. Thank you, guys. I'm sorry it was a little bit rushed.
No, not at all.
No worries. This is helpful.
It was perfect.
Thank you, Dr. St. John.
Thank you all.
Bye, John and Gabby. Thank you.
Yes, of course. We'll talk soon. Thank you so much.
Take care.
Bye.
Take care.